Good evening, all.
Good evening, ma.
Good evening.
Wishing you all a happy new year. You are all welcome to our first lecture
Thank you.
for the year 2026. To God alone be the glory. I am Mercy Basi EFIONG, your lecturer for this course. And I am a nurse, a midwife, and a public health nurse.
Wow.
In this semester, I'll be teaching you reproductive health. And reproductive health here consists of adolescent health and family planning. I believe this is not the first time you are hearing about reproductive health, adolescent and family planning. So since this is not the first time you are hearing about this course, we will be doing mostly discussions. I will not talk alone for 2 hours. I will not do the talking alone. I will talk and you will also talk. We will discuss. I will not do the talking alone for 2 hours. I will talk. We will also talk. We will contribute and share ideas. So the course is reproductive health. Once again, you are all welcome. While the lecture is on, we will reserve our questions. At the end of the lecture, you will be given opportunity to ask your questions. And the question is for the group. Any question that is asked, we will all answer. So you are welcome once again. So let's see what we have for today. So our course title is Reproductive Health. Under that, we have Adolescent Health and Family Planning. Course code MIDW 463. Since it consists of adolescent health and family planning, we have heard of the two words. I would like us to start with family planning, which we are all conversant with. And most of you are coordinators or directors in family planning units. So those ones who are still there currently, we will share ideas and they will tell us the current issues in family planning when we get to those areas. For today, we will be talking about the course description for the whole course and then family planning. So this course is designed to equip the learners with knowledge, skills, and attitudes to deal with reproductive health needs and problems of the adults, as well as to promote the general reproductive health of the adolescents. So it is also to provide the learners with counseling skills to motivate clients to accept and practice family planning. So even though we are talking about adolescent health, we are also talking about family planning, but with emphasis to adolescents. Then the learning outcomes. At the end of this course, all the learners will be able to motivate clients to accept family planning. We will also discuss government policy in relation to population issues, counsel clients and families to practice family planning, provide reproductive health services to people of all ages, identify and manage clients with sexually transmitted diseases. So today we'll be taking introduction to family planning. We'll first of all talk about the history of family planning. How did it all start? Before we get to what family planning is all about, we'll talk about the history of family planning. So we'll talk about the history of family planning. The family planning movement owes its existence to a professional nurse by name Margaret Sanger. She worked among the lower income group in the west coast of New York, and in 1940, Margaret Sanger devoted her time to study the birth control measures because of high risk of abortion and its complications. Many people were dying and many children were still born into the society. So there was rapid population growth, notwithstanding the number of deaths. People were being delivered and people were dying. So she took it up and wanted to find a solution to it. So in 1942, her National Birth Control League progressed to American Planned Parenthood Federation and RATE. And then it grew to become International Planned Parenthood Federation in 1952. So it took 10 years, from 1942 to 1952, for the name to change to International Planned Parenthood Federation. Then in Ghana, in Ghana, the Christian Council of Ghana started family life education in the form of marriage counseling in 1961. And in 1967, the Planned Parenthood Association of Ghana was formed to widen the scope of family planning activities. So they decided not to leave it to the Christian Council of Ghana alone, which would have limited it to different churches. They now expanded it to Planned Parenthood Association of Ghana in 1967. And then the scope was widened and family planning activities were introduced, and modern contraceptives and contraceptive technology were used. And then what is family planning? What is family planning? What is family planning? Family planning, as you all know, is a process of sensitizing a couple or an individual on making informed decision on spacing, timing, and the desired number of children using contraceptives and other techniques. So the person must be informed, and after getting the information, sensitizing the person must now make informed decision on the spacing, timing, and the desired number of children using contraceptives or other techniques. Let's look at other definitions. According to World Health Organization, family planning is defined as the ability of individuals or a couple to anticipate and attain their desired number of children and the spacing and timing of their births. Or it is achieved through the use of contraceptive methods and treatment of involuntary infertility. This definition and the first one are almost the same. The first one, there must be an informed sensitization and informed consent. The people must be informed, and then they will now make their choice. So this is having children by choice and not by chance. They have to be sensitized. An individual is sensitized, or a couple, and then after that, they now make an informed decision on spacing, timing, and then the desired number of children using contraceptives and other techniques. So this time you don't just deliver because you want to have as many children as possible. This is children by choice and not by chance. Then the scope of family planning. Family planning is very wide. And what is the scope? Under the scope, we have sex education, preconception and interconception care, screening and treatment of sexually transmitted diseases, education on family life, management of infertility, carrying out pregnancy tests, counseling and provision of effective contraceptive methods for men and women. So family planning is not just for the woman alone, for men and women. Just as you are seeing it on the picture, a woman is seated there, very interested. She's interested in the demonstration by the health worker, and the man is sitting there watching. Then there are some national rights and privileges for family planning. So we also have reproductive health, that it can be defined as a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity, but in all matters relating to reproductive system its functions and processes. So for us to be able to implement family planning, we must be able to know what reproductive health entails, because this family planning is used in the reproductive system. Whatever is done under family planning is to regulate the reproductive system so that one can have children when desired and not anyhow. So the government of Ghana also issued a definite policy in March 1969 to ensure the following: to find out measures to reduce high fertility rates by providing information on the negative effects of rapid population growth and means by which couples can effectively and safely control their fertility. So Ghana government also had to put up a policy so that people will not deliver anyhow. You deliver the number of children you can take care of when you want it. Children by choice and not by chance. So Ghana government had to put up that policy in March 1969. Then they also had to find measures to reduce the fertility rates by providing information on the negative effects of rapid population growth. We'll come to that later. We'll have to discuss that, the negative effects of population growth, and by which means couple can effectively and safely control their fertility. That was one of the policies. Then the second one was to find means of reducing high morbidity and mortality rates. Women were dying, women were getting sick after delivery, so they had to find a way of reducing that. And also to improve information, communication assistance for couples who wish to space or limit their reproduction. They had to have a policy to assist those who will want to space and those who will want to limit their reproduction, and those who want to have more, those who don't even have but need some. Family planning unit can also assist them. Then other policies were also made concerning family planning here in Ghana, that family planning should be a component of reproductive and child health in every health institution. So if you go to every health institution, you must have family planning as a component. And then family planning should be incorporated into the training curriculum of all health personnel. All training institutions have to incorporate family planning into their curriculum to show that family planning is a very important course. Every health worker must know about family planning. Then in-service training on family planning should be given to all health personnel according to their level of training. All health personnel according to their level of training. Some are given more, some are given less, according to their level of training. Then the in charge of reproductive and child health services in an approved Ghana Health Service institution should be the coordinator of family planning services. So anybody that is heading that unit should also coordinate family planning services to show the importance attached to family planning. There are also other rights that we have, other reproductive rights. And these reproductive rights refer to composite human rights that addresses the matters of sexual and reproductive health. There are some rights that must be there, and they address human rights in matters of sexual and reproductive health. Here we teach the ideal. This is what it should be, and this is what obtains in other countries abroad, because most of us are preparing to go abroad after our training. So when you get to abroad, there are rights, reproductive rights that are in force. But here, where we are at the moment in African countries, they may not institute those rights, but these rights are necessary and these rights are operational. But in overseas countries or in abroad, they are put in place. But in African countries, we don't really regard them. But since we are in the school and we are preparing to go and work abroad, we must know these rights so that when we go abroad or we are taking any exam abroad or to go abroad, you know that there are reproductive rights which should be put in place, even though in your country it is not there at the moment, but we'll get there. Reproductive rights consist of three broad categories of rights. We have right to reproductive self-determination. Right to reproductive self-determination. You can determine when to have your children. Right to sexual and reproductive health services, information and education. Everybody has that right. We also have right to equality and non-discrimination. That is what is obtainable in civilized societies. We will get there. Then we also have 12 human rights key to reproductive health. We have 12 human rights key to reproductive rights. Just as I said earlier, we teach the ideal. This is what it should be. This is what obtains in abroad that we will be going to after our training here. But in sub-Saharan African countries, they may not be in force, but this is what it should be. So reproductive rights arise out of established human protections. They are also essential for the realization of a wide range of fundamental rights. And we should ensure that women and adolescents can determine when and whether to bear children, control their bodies, and sexuality, and sexual access, essential sexual and reproductive health information and services, and live their lives free of violence. This is what it should be. But here in sub-Saharan African countries, I read some time ago, a woman denied a friend sex, she was killed. I think it happened recently. I read it somewhere. So one should live life free of violence. But you see, people being killed, a woman being killed for denying their boyfriend or husband sex in an African country. But it shouldn't be that way. So we have rights. And these rights have to be so there is right to life.
Hi, where is all your
So there is right to life. There is right to liberty and security of the person. There is right to health. There is right to health. There's right to decide the number and spacing of children. And there's right to consent to marriage and equality in marriage. Remember, as I said, this obtains abroad. In an African country, there's right to consent of marriage. There is not there. If you are asked and your hand is asked in marriage and you don't want it and your parents want, they force you into it. And equality in marriage is not obtainable here, but it may be obtainable or practiced abroad. There's right to privacy. There's right to equality and non-discrimination. There's right to be free from practice of harm, practices that harm women and girls. Remember, we teach you the ideal. This is what it should be. But in some communities, they are still practicing female genital mutilation. In some communities, they are still practicing female genital mutilation. So in that case, these are practices that could harm the girl child and also harm the woman. There's right to be free from torture and other cruel, inhuman, and degrading treatment or punishment. There's right to be free from sexual and gender-based violence. There's right to education and information, and right to enjoy benefits of scientific progress. These are human rights that we must know. Even though it's not practiced in your immediate environment, these are the standards, these are the ideals. So we may be asked in an exam, you will not write what is obtainable where you are living, but you have to write the standard general reproductive rights. Family planning services serve three critical needs under the importance of family planning. It serves 3 critical needs. It helps couples to avoid unintended pregnancies. This we know. I know some of us here are directors, some are coordinators of family planning units. And we know from our diploma experiences that family planning serves 3 critical needs, helps couples to avoid unintended pregnancies. It reduces the spread of sexually transmitted diseases or infections. By addressing the problem of sexually transmitted diseases, it also helps to reduce infertility. We have all heard of family planning, and we have been told or reminded about the definition of family planning. What do you think are the factors that can affect population growth? And then the second question, what are the benefits of family planning to individuals, families, communities, and the nation? So we'll start with the first one. If you want to say something, you show your hand and then you unmute yourself and then say it. So what are the factors that can affect population growth? Let's discuss that one. What are the factors that can affect population growth? Jennifer?
Ma'am, please, immigration. The immigration rate can cause fertility growth, population growth.
How?
Okay, ma'am, please, when we have more people coming into a country to come and live, definitely they are going to reproduce, which will make the country's population grow.
And conversely, if we have people traveling abroad, many people traveling abroad. So under migration, we have immigration and immigration. So when people come in, they will come and there, and the population will increase. And when people go out to other countries, the population within the country will reduce. Any other? Homo, Haruna.
Sister, please, high fertility rate.
Okay. So how will that?
When the fertility rate of the community or the country is high, we tend to produce more babies, which increase the population growth of the country.
Good. Any other? Any other answer? I have not seen another hand. Florence. Florence. Florence, unmute yourself and say something. Florence Amo. Florence, we've not heard you. Unmute and say something. Any other factors that can affect population growth? We've only heard of 3. What are other factors? Irene?
Yes, sir. Low educational level among women.
How will that affect population growth?
Sister, if women have more knowledge and have education about family planning, sex education, and other things, it might delay the rate at which one gives birth to increase population. Thank you.
And conversely, if they don't go to school,
it increases the population rate because they will have no knowledge about it. Even if they will have it, to be smaller and lesser understanding of what is happening.
and then they can deliver two times in a year. They
Yes,
deliver in January of that same year. By December or November, they deliver again.
yes.
Monica? Can we hear from Monica? Monica, unmute yourself.
Yes, mommy.
What are the factors that can affect population growth? Monica, unmute yourself and talk. Okay, let's hear from Gifty. Monica is not ready. Gifty.
Hello, mommy.
Okay, who is talking now?
I said sometimes cultural and social beliefs can also affect population growth.
How?
Some cultures, they prefer to have larger families. And probably let's assume that maybe in a particular family, they want to have more male children. And then the woman to also intend to deliver females. So they'll keep on trying. And before you realize, they end up having a larger family size.
And they may not even achieve
And then
what their aim
sometimes,
was.
yes, and sometimes to social pressure to also have many children.
So that they will use it for what? Social pressure.
To also maintain the
One person
to
at a
maintain
time.
their limit.
Okay. Who is talking now? Monica?
Yes, mommy, Monica.
Monica. Okay. So maintain their lineage. So they end up
Yes,
having,
mommy.
they have up to 15 children.
Yes.
Or 20.
Yes.
To maintain their lineage or to have a
Yes.
desired sex,
Yes.
which they may not have. God will help them. Okay. Let's hear from
Amen.
Gifty. Gifty, are you ready now?
Yes, ma'am.
Let's hear from Gifty.
The age structure.
The
age structure.
How?
If the proportion of the reproductive age group is higher, then we will tend to have a higher population.
Okay. Ernestina. Let's hear from Ernestina.
Environmental factors
Like
drought or a natural disaster.
How will that affect the population?
Also, that is through migration and death.
Okay. So when there is disaster, people will move.
Yes.
And what else?
And others, people will move, others too can die.
Okay. And that will reduce the population.
Yes.
Is there any other factor that affects population that they have not mentioned? I've not seen hands up. We are more than 600. I expected more hands. Okay. You have all tried by giving us the answers on factors that can affect population growth. I've heard fertility, that fertility can affect population growth, migration, immigration and immigration, people coming in and people going out. I've heard about education, that if women are well educated, they will be able to accept family planning and reduce the number of children, or be able to have children by choice and not by chance. Then we have also heard of environmental factors such as drought or disasters. So you find out others and add. There are other factors that could also affect population growth. So the next question for our discussion is benefits of family planning to the individual, families, communities, and the nation. So what are the benefits of family planning to the individual? What do you think are the benefits of family planning to the individual? I want others who have not raised their hand to do. So after this, I want others who have not raised their hand to raise their hand and answer. Let's hear from Monica.
Mommy, please, it reduces pressure on social amenities.
Benefits to the individual.
You are able to cater for your family, especially the children, but in a situation whereby you end up having plenty children, you might not be able to cater for them. But a situation whereby there are 2 or 3, you are able to take care of them.
And send them to good school. Okay.
Yes, mommy.
That's good. Any other? I need two answers from each person. So when you raise your hand, you are giving me two benefits of family planning to the individual. Can I hear from Eunice?
Yes, please. So please, it also prevents unplanned pregnancies. Okay. So it helps the individual, yes, and then it's also reduces the risk of unsafe abortions.
Any other? Thank you, Eunice.
Thank you.
Elisu Rashid.
Hello, madam.
Say something.
Madam, please, it helps.
A male or a female?
I'm a male.
I like mid-husbands. Say something, please.
Yes, please. It helps improves the individual emotional and mental well-being.
Good. Why?
Yes, and then it's also...
How?
Pardon?
I say how? Why?
It reduces stress and anxiety in the spouse in the sense that they are able to space in childbearing. So they don't have children at any time. They're able to space, in a sense that when a child is 2 to 3 years, then they give birth to another child to help reduce anxiety and stress.
Good.
Yes, and then it also helps in protection of the family. As in, yes, protection, and it enables the individual to be able to cater for one child at a time.
Okay. Any other? Can I hear from Bernice? Bernice, unmute yourself.
Yes, ma'am, please. It also allows the woman's body to rest and heal before another pregnancy.
Good. Any other from Bernice? Okay. Bokbori. Agnes.
Madam, please, it also reduces financial burden on the individuals because they do not have many children to cater for.
Okay. Any other? So let's talk about the family. Let's talk about the family. Ruth. Ruth, can I hear your voice? Unmute yourself and talk.
Has really perfected the art of consensus building around its values.
Ruth, louder, please.
Come together at the shared table.
Hello, Mama.
Hmm?
Please, it helps the family to provide food and clothing for the children.
Okay. One person at a time.
All the developing countries alike.
Who is talking now?
We are determined to cause correct.
Abdullah.
A transformative plan to build democratic governance.
Abdullah.
In climate resilience.
Somebody is reading for us there.
And entrepreneurship.
Abdullah, unmute yourself and talk.
That is why we sense kinship with our prime minister.
Hello.
Yes.
You are free.
Abdullah, unmute yourself and talk.
Mama, please, it enables the families to be able to take care of their children.
Okay. Okay, let's talk about the communities. What are the benefits of family planning to the communities? Who is talking?
Marie.
Okay, Marie, Stella.
Yes, ma'am.
Okay.
It reduces the pressure on social amenities like the school, water, and housing.
Good.
And it also improves the overall community health and standard of living.
That's good. Let's hear from Ibrahim.
I unmute myself.
Ibrahim.
Hello, sister.
Say something.
Hello.
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 Yes.
Please, it reduces maternal mortality and morbidity in a sense that women don't have to go through unwanted pregnancy and cause unwanted unsafe abortion.
Okay.
It also increases productivity.
Really?
Yes,
okay.
please.
Thank you.
Because a healthy family can work harder to improve the lives of their families.
Okay, that's very good. Can I hear from Ernestina? Unmute yourself, Ernestina.
It reduces overpopulation.
Okay. Is that all?
Yes, please.
Okay. So what are the benefits to the nation? What are the benefits to the nation? Ibrahim, what are the benefits of family planning to the nation? Ibrahim. Lillian. Lillian, unmute yourself and say something.
Hello, Doc. Please, it reduces societal crime rate in the sense that if you have the number that you can cater for, you'll be able to train them the way you should train them, in that they will not become social deviants. Thank you.
Thank you. Any other hand there? Lillian, is that Lillian that has finished talking?
Yes, Doc.
Okay. Who else is there? Ernestina.
Doc.
So,
please, it
what are the
controls
benefits to the nation?
It controls population growth.
Okay.
And it also improves the standard of living.
Okay. To the nation.
Yes.
Thank you for your contribution. Is there any other person there? Rosemond. Rosemond, unmute yourself.
Please, sister, it brings about national.
It brings about development.
How?
It brings about national development.
How?
In a way that, because people give birth to the number of children they will be able to take care of, they're able to give them quality education and good health. And in return, they're able to grow to become better members of the community, to work to develop their communities and the nation as a whole.
Okay. Ruth.
Mama, it helps the government to provide schools and better infrastructures for the students.
Okay. You have any other? Any other?
Also able to development to the people, like roads, schools.
I'm taking the last person, Abdullahi Imaya. Unmute. Abdullahi.
Yes.
So, what are the benefits to the nation?
Mama, please, it increases the active use of the nation, active working force of the nation.
How?
Yes, that is if a family is able to cater for the number of kids they can be able to cater for. Like maybe they can take care of them properly. Definitely, those children will grow to be proper individuals, and thereby they will get employment. And if they get employment, it means that they will be the active participant of the youth, which in any way can increase the development of a country.
Okay. You've done well. I hope others have heard. I hope we have all heard the benefits of family planning to the individuals, families, communities, and the nation. Abdullah, some other time, let's move to some other subtopics so that we can finish. Thank you for all your contributions. So this is a diagram of the gross anatomy of the female reproductive system. We are familiar with this diagram. We are all familiar with this. This is not our first time of seeing this diagram. The female reproductive system. Because in family planning, we have to talk about the female reproductive system. It's a diagram of the female reproductive system. We all know it. If you had forgotten about it, you get the drawing, draw it and know it. Know that this is the uterus, and then know that this is the fallopian tube, that there are two fallopian tubes. And then we have the cervix, we have the vagina. So know about it, get the diagram and read about it. So this is still another diagram of the female reproductive system. We are all used to it. Please mute yourself. Mute yourself. You are coming in late and you are making noise. So another diagram of the female reproductive system. We have the fundus of the uterus. We have the fallopian tubes. We have the fundus of the uterus, the fallopian tube, and then we have the corpus luteum, the ovary, developing follicles, and then newly discharged ovum. We have the cervix, we have the vagina. We have the broad ligaments, the round ligaments, ovarian ligaments, the ovary, the fimbriae, and the suspensory ligaments of the ovary. This is just sorry. So this is the, what's happening here? Diagram of the reproductive system. Why? This I'm coming. Oh, we've taken 1 hour and it off on its own after 1 hour. It should have, the meeting is for 2 hours. I don't know why it went off after 1 hour. So stay on. It went off.
No, it's closed. Let me check for you.
Check.
It's you are still on the meeting, so you have to share the screen again. See, the PowerPoint is closed.
The PowerPoint, I was still using it only.
The PowerPoint is closed. So where is it? Is it this one?
No,
the edited
it's
one?
family planning.
Family planning. Where did you
How
put
did
it? Okay,
No.
okay, let me find it. The PowerPoint closed, that's why.
God closed it. I was still teaching with it. Only.
The battery is almost draining. Do you have a charger?
Yes.
Okay.
Maybe that is one of the causes. When I came in, I looked for where to plug it. I did not see. Where will it be plugged? I looked for where to plug it. I did not see.
There's one here. This one is taking time to respond.
And 600 and
yeah, more than 600. It should be more, like somewhere like 900.
When I started, there were 497 that they connected.
Yeah, so it should be around 900, 2,000.
Mm-hmm.
Yeah, in total, they are like 3,200 and something. So that means some of them didn't join the class.
Some are joining.
It's fast, but like an hour.
Immediately it was, I started at 5:20. So immediately it was 6:20. It went off.
Really?
Yes.
Hey, mom, yes.
No, I checked the time. Immediately it was 6:20. It went off. This is 6:24.
Okay, we'll check it from
Please
there
check.
if it is from us. And then the funny thing is that they are still on the meeting.
They have to. The meeting is 2 hours. Don't go away. I'm here. So where is it now?
It's coming. This is from the PowerPoint.
See it here. Let's go to slide 17.
Oh gosh, so crashy.
You did not and some of this thing went up, like this, all these settings, they were inside. And I used this
You can talk, ma. Bye you.
Thank you. Let him not do that nonsense again. Hello.
Hi.
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 Sorry for the break in transmission. It was due to technology error. Technological error. So we'll continue. This is the diagram of the reproductive system, female reproductive system. So we have to go back and know how to draw it, and then also the labeling. Read it and know it. Then the diagram of the vulva. You need to know about this in family planning. So you have to go back and draw it, study it and know it, because you may be given the diagram and asked to label it. So know about the gross anatomy of the female reproductive system, what it entails, and also the male reproductive system. Because in family planning, we need to use the two, both the female and the male reproductive system. Then these are the organs of the male reproductive system and their functions. We have the testes and the seminiferous tubules, and then they are used for sperm production, the collecting ducts for transport and storage, epididymis. So you go and read through and check the functions, what they are for. Please mute yourselves. Mute yourself. Then the seminal vesicles, they secrete thick liquid and they transport sperms. The prostate glands, their function, secrete thick alkaline solution.
The
Mommy, good evening, sir. Apple.
You will be stopping things and people will be shorting.
Rahana, please mute yourself.
Mute yourselves. Sorry for the break in transmission. So we have the organs of the male reproductive system and their functions. So we have to go and read them and know them. Remind yourself of the organs of the reproductive system and their functions. The penis, the scrotum, the testes, the epididymis, ductus deferens, spermatic cord, prostate gland, and the seminal vesicles. Know about them and their functions. Then the menstrual cycle. Remember, as I said earlier, we need both the female and the male reproductive system while carrying out our family planning. So we have seen the diagram, gross anatomy of the female reproductive system and that of the male. So you go and read and know what their functions are. Then the menstrual cycle. But the menstrual cycle are a series of changes that occur monthly in the uterus under the influence of the hormones from the pituitary gland and the ovaries. And that the average menstrual cycle will repeat itself every 28 days. But the normal cycle ranges between 21 to 35 days. And that there are some neurohormonal control of the anterior pituitary gland by the hypothalamus. And that the cycle can also be influenced by emotional factors such as change of job, relocation, or movement from one country to the other, or maybe by death of a loved one. Some emotional factors can also affect the menstrual cycle. There are 3 phases of the menstrual cycle. There are 3 main phases of the menstrual cycle. So we have the menstrual phase, regenerative or proliferative phase, and the secretory phase. We had done this in our diploma programs and in other courses. So this is just a reminder of the menstrual cycle, that there are 3 main phases, and that the menstrual phase, the bleeding usually lasts between 3 to 5 days. But for some people, it can extend to 7 days. And then we have the regenerative or proliferative phase. And this phase follows the menstrual phase and lasts about 10 days, sometimes till ovulation. And sometimes till ovulation. Then we have the secretory phase. And that the secretory phase usually lasts about 14 days after ovulation. And that the effect increased production of progesterone by the corpus luteum and takes on secretory activity on the endometrium, with the main aim of preparing it to receive and nourish a fertilized ovum should one be available. So the menstrual cycle has 3 phases, and remember them: menstrual phase, regenerative or proliferative phase, and the secretory phase. And this is a diagram showing the different variations. We have the effects of the hormones on the ovarian cycle. We have the effect on the body temperature. We have the effect on the anterior pituitary hormones. We have the ovarian hormones, and then the uterine cycle. The ovarian cycle, we have the ovaries growing and the growing follicles. And as this is taking place, the body temperature is at a low level. The anterior pituitary hormones are at a lower level, ovarian hormones at a low level, and then under the uterine cycle, we have the follicular phase and then the menses. Then after 5 days, we also have the follicles growing until on the 14th day, we have the ovulation. And when the ovulation is on, there is an increase in the temperature. And then we also have increase of the luteinizing hormones and then the follicle stimulating hormones. And then the uterine walls are growing gradually. So after ovulation, we now have the empty shell known as the corpus luteum. And then the corpus luteum, and with the corpus luteum, we have the ovarian hormones increasing to produce progesterone. And then the uterine walls grow more, expecting if there will be a fertilized ovum to embed. That's the luteal phase. And then if after 28 days, that's 14 days from the time of ovulation to the end, if there's no fertilized ovum to embed, then the uterus will be disappointed and will shake. Some people say it's called the tears of a disappointed uterus. That is when the person may have menses. The person will have menses. The person may have menses. So for the different variations in the female cycle, we have the ovarian cycle, the temperature, then the anterior pituitary gland hormones, the ovarian hormones, and then the uterine cycle. All these work together. The menstruation, ovulation, production of progesterone, and the pituitary and ovarian hormones, and then the endometrial cycle. All these work together in the female system. Are you hearing me? Am I being
Yes,
heard?
madam.
Yes,
Yes, madam.
Yes, sister.
Are you still there?
Yes,
Yes,
yes, Doc.
Okay. So we still have a demonstration of the effect of the hormones. The effect of the hormones on the endometrial lining, premenstrual, menstrual, and post-menstrual. You see, during the premenstrual period, the endometrial layer growing. It grows premenstrual, expecting a fertilized ovum. This is it here growing, expecting a fertilized ovum. The endometrial lining grows and is thick. Same thing happens here. But if there is no embedment, menstrual period occurs, menstrual cycle occurs, so it will shade. And this is it here. As it shades, it results in menstrual flow. And then after that, we now have the post-menstrual period, which is this. And then the endometrial lining starts growing again, expecting an ovum to be fertilized. So it is a cycle, and the cycle takes 28 days. It is a cycle. So we have the premenstrual phase, the menstrual, and then the post-menstrual phase. The same thing for emphasis in a different way, that the cycle takes 28 days. So we have menstruation occurring from the first 5 days. In some people, it takes 7 days. So after the menstruation, then we have the next 14 days. And on the 14th day, we are expecting the person to have ovulation. And then after that, it now goes to the 20th day. So between the 8th day and the 19th day, the person is said to be fertile. The person, even some people get pregnant. Even with menses, they get pregnant. Some people that are highly fertile. I've seen a woman after delivery. She went on maternity leave 3 months. She returned back to work with another pregnancy. So some people are highly fertile, so they can get pregnant anytime. So here we have the first 7 days as the menstruation period. And then after that, the next 14 days, the person is said to be very fertile. And from the 20th day to the 28th day, the person is said to be infertile. But some people that are highly fertile, the calendar method does not really favor them. We'll come to that later. So this is still an emphasis on that diagram. Menstruation period, 1 to 4 days. Some people have 1 to 7 days. Emphasis on the first one. Then, in case the ovum was fertilized, this is a diagram showing how the fertilized ovum moves from the fallopian tube until it is embedded within the uterine wall, within the endometrium. We'll discuss that in detail, or it has been discussed in detail in other subjects. So we are still revising that. We have to update our knowledge on how the fertilized ovum moves from the fallopian tube into the uterus. Still the same diagram, but in another form. Migration of the conceptus. Okay. So this takes us into another question. Family planning history taking. Most of us are coordinators in family planning. And when our clients come, we take history. So how is family planning history being taken? How do we take history when our clients come for family planning? How do we take history when our patients come for family planning? What type of history do we take from them? If you know, raise your hand. What history do we take from patients when they come for family planning? Miriam? Miriam, unmute yourself and talk.
We take personal history, menstrual history.
Is that all?
No.
What other history do we take? Patients.
Parts of sexual history.
Good. Any other? Jennifer?
Pues.
My reproductive history.
Bernice? Bernice?
Yeah, sexual history.
Sexual history, what else? Deborah?
My reproductive history.
Reproductive history. Deborah?
Medical history.
Medical history. Any other history? Mariana? Mariana?
Surgical history.
Surgical history, medical history, sexual history, reproductive history. Any other? Monica?
Yes, mommy, please, sometimes you can also ask of their fertility intentions because, some of the family planning drugs like the depot, since it delays return to fertility. So sometimes you can ask of the person, like maybe when does he intend to get pregnant again?
Okay.
And then you have to also you have to also do screening and counseling. Maybe probably the person came being pregnant. And after the family planning, the person will go back and tell you that the family planning that you did for her, it didn't work out. So sometimes you have to do screening and counseling.
Okay. Thank you. Abudu? Abudu? Abudu, unmute yourself and talk. . Abudu, are you still there? Unmute yourself and talk. Deborah, do you still have something to say?
It's a react of allergies.
Okay. Any other? Monica?
Mommy, please, sometimes you can also ask of the person's lifestyle and then the social history. Like, do you smoke? Do you take in alcohol and the rest? Then surgical history, like maybe past ops, past surgeries, and then maybe history of maybe any cesarean section.
Good. Okay. So we will take that as our assignment. We will write it in your notes, how family planning history taking is done. Find out how it is done. Write it in your notes and read it. Write out in your notes and read it, how family planning history is taken. We have to write it in our note and know it. So for today, we have started with our introduction to reproductive health. And I said that reproductive health, in this class, we will be talking about adolescent health and family planning. And that this is not the first time we have heard of this. And the course description, I said that this course is designed to give us knowledge and skills and attitudes to deal with reproductive health needs and problems of adults, as well as promote the general reproductive health of the adolescent, and that it provides the learners with counseling skills to motivate clients to accept and practice family planning. And I said that we will be starting with family planning since we have heard of it before, and that we will be discussing family planning first, and after family planning, we will now discuss adolescent health. Then the learning outcomes. We were told that at the end of this course, every learner will be able to motivate clients to accept family planning, and that we will also discuss government policy in relation to population issues. And we will also counsel clients and families to practice family planning, provide reproductive health services to people of all ages, identify and manage clients with sexually transmitted diseases. Then we had our introduction to family planning. We had the history of family planning, that family planning owed its existence to a professional nurse named Margaret Sanger, who worked in the lower coast of New York. And that in 1940, Margaret Sanger devoted her time to studying birth control measures because of high risk of abortion and complications of unsafe abortion and deaths. And that in 1942, her National Birth Control League progressed to American Planned Parenthood Federation and rates. and then became International Planned Parenthood Federation in 1952. And that in Ghana, the Christian Council of Ghana started family life education in the form of marriage counseling in 1961. And in 1967, Planned Parenthood Federation of Ghana was formed to widen the scope of family planning activities, and that they introduced modern contraceptives and contraceptives technology. Then we defined family planning as a process of sensitizing a couple or individual on making informed decisions on spacing, timing, and desired number of children using contraceptives and other methods. And I said they have to sensitize the people, sensitize the individual or the couple, allow them to make informed decisions on the spacing, timing, and desired number of children they want. So it's children by choice and not by chance. Then we also heard about the WHO definition of family planning, which is also the same with the first one we defined, that you educate the people and give them the ability to anticipate and attain their desired number of children and spacing and timing of their births. And this could be achieved through the use of contraceptive methods. We also discussed the scope of family planning, that the scope is wide. It includes sex education, pre-conception and intra-conception care, screening and treatment of sexually transmitted infections, education on family life, management of infertility, carrying out pregnancy tests, counseling and provision of effective contraceptive methods for men and women. So family planning is not only for women alone, it is for both couples, the man and the woman. We also discussed the rights and the privileges, that we have reproductive rights, and that these rights are really enforced abroad in overseas countries. But here we teach the ideal. It may not be practiced in your country or in our country, but we have to know them because of globalization, and some of us will be traveling out to work abroad. So we must know what the correct standards are. So we said that reproductive health can be defined as a state of complete physical, mental, social, and social well-being, and not merely the absence of disease or infirmity, but in all matters relating to reproductive system, its functions and processes. So we also discussed about the male reproductive systems and the female reproductive systems. And I said we should go and draw them and learn about their functions, both the female reproductive system and its functions, and then the male reproductive system, the anatomy and their functions. We also said that there are some rights and policies in Ghana, and that the government of Ghana issued a definite policy on population on March 1969 to ensure that they find measures to reduce fertility rate by providing information on negative effects of rapid population growth, and also to find means of reducing high mortality and morbidity rates. and also to improve education and assistance for couples who wish to space and limit their reproduction. So there was a policy by the government in 1969. And we discussed the policy in every health center that they must have a section or a unit for family planning, and that family planning has to be incorporated into the training curriculum of all personnel, and in-service training organized for family planning workers. And then everyone who is in charge of reproductive and child health services in an approved Ghana Health Service institution must be a coordinator of family planning services. We talked about the rights and the human rights. We talked about rights, the 3 rights. And I said, even though it's not operational in your country, know the correct thing. And then the 12 human rights and reproductive rights. Then the family planning said 3 critical needs. I mentioned those critical needs, what they are: to avoid unintended pregnancies, reduce spread of sexually transmitted disease, and address the problem of sexually transmitted diseases. Then we discussed the factors that can affect population growth. Go and read it and know it. And also know the benefits. Know the benefits of family planning to the individual, to the family, to the community, and the nation. We discussed that. Then you were shown the gross diagram of the gross anatomy of the female reproductive system, and then the male reproductive system. So go and read and know the functions. We also discussed the menstrual cycle, that it is a cycle that lasts for 28 days. We also discussed the phases of the menstrual cycle, that it has the menstrual phase, regenerative or proliferative phase, and the secretory phase. And then the variations in the ovarian cycle, the temperature, the anterior pituitary hormones, the ovarian hormones, and then the uterine cycle. We discussed the various aspects of it, and then the premenstrual phase, the menstrual and the postmenstrual, and how they affect the endometrial layer of the uterus. We also discussed the menstrual cycle, and then implantation, and then how the family planning history is done. So go and carry out your assignments, write it in your book. Also write out the factors that affect population growth. So we will stop there for today. We will continue next week. Good evening once again.
Good evening. Good evening, sister.
Any question? Do we have any question?